it's Cole, and today is the 15th of December. It's 15th of December, and today I am actually 2 months post-op. Um, Surprise, I'm still having internet connection issues, which is why I've not been updating regularly. I can't figure out what's going on. It's like I'm the only one having this problem. Um, but today, because it is my 2 month post-op, I'd like to show you my chest again because I'm vain, and also I'm, I think like right under 3 weeks, or actually I'm about a month, a little less than a month away from being a year on testosterone, um, which is insane to me. So today I went down to my doctor's office, and I've been having some pretty intense cramping throughout the few months. Usually just like around the time that I would normally have like bleeding, which I don't obviously have anymore. But I talked to her about it, and we were talking, and I was like, yeah, I really do want to get a hysterectomy, and she's like totally on board, except for, and I knew this, but she was like, well, they're not gonna take out a uterus in somebody that doesn't have any problems, and proving to insurance companies that a 24-year-old has such intense problems that it would result in a hysterectomy is pretty intense, which is really hard to do. And I just think that's ridiculous that, like, even if my insurance would cover it, that they wouldn't unless I was dying, basically. That, like, I don't have the choice in getting that piece of my body removed when all it's doing is causing me, like, mental distress and physical, like, uncomfortability. I don't even know if that's a word, but it's making me really uncomfortable. But she said that it's normal, and as cramping goes, and that because I'm not bleeding, I don't really need to worry about it too much unless I do start bleeding. So I'm really upset because my insurance, like, is anti-trans. Like, they don't help you at all, which is really frustrating. So I couldn't even get it covered up by them. So I'm just going to be waiting and seeing. But what was upsetting, and I love my doctor. She's awesome. She's always been really cool. I go to an LGBT clinic, so she has worked with trans people for like 14, 15 years. And my friend Rowan, who's also trans, goes to see her, and she's great, but she was saying that she's like for me to get a pap done. Trigger warning, sorry. She wanted me to get a pap smear done so that at least we could make sure that everything's going the way it should. And I thought she meant like, oh, I had to schedule with the gyno and then go. And so I kind of put it at the back of my mind because I'm actually scheduled. It's been 3 years since my last one. And as I got up to leave, she was like, okay, get dressed from the bottom down. And like, I was like, what? Like, I completely just didn't even understand what she was saying. And then I realized she was going to give me that at the office. So that was fun. She did say that I had a lot of growth, which, I mean, was a compliment. But it wasn't as uncomfortable as I thought it was going to be, mostly because she's really nice, and she was just like almost just as awkward because I know that she understands how trans men feel about that, so she was trying to do it as quickly and comfortably as she could, which I really thank you. But we'll see what my test results say, I guess. So basically I'm healthy, so that's good. So I guess I will show you what my chest looks like. Not too many changes. I have a concave chest, so as I think I've stated before, I still haven't really done much. I've been lifting weights a little. I've lost so much weight since surgery. Before going in, and I said this last time, I was pushing 140, and I went in to get weighed today, and I'm like barely 125 pounds, which is so upsetting. And I've been eating so much, and I just, like, I can't put on the weight. And, like, I went back and watched some of my older videos, like 3.5, 4 months on T, and I looked good. Like, I was getting thicker and all these things, and then, like, surgery just kicked my ass. But here, all right. Oh, I'm also growing out my hair. That's why it looks really bad. But hey, you know. Okay. So that's what my chest looks like 2 months. You can see there how it like dips down. I really don't know what else to do other than like I stretch a lot and stuff like that, and I try to lift weights. I mean, yeah, look at that. But I don't know what else to do for it because it's just like, I think what really bothers me about it is like if I wear a shirt, you see how it like dips in like that? I could like eat soup out of it or something. Like it's a bowl in my chest. Ugh. But I guess it's just from going like this for so long, you know, hunching. So I've been trying to do like stretches and stuff, but I didn't even realize I had that problem until after surgery. So things you learn. But I think I'm doing pretty well. My incisions are okay. I got some, they stretched a little bit here because I popped an incision, or a stitch, and then they started like rejecting and stuff and leaking and grossness. But I just kept it really clean and kind of let my chest do what it was going to do, kept it covered, and it's been healing. I have a little bit of a spot here that's giving me some issues, as you can see. My nipples are still kind of raised a little bit, and they're really sensitive, which is crazy because I didn't think I'd be able to feel them, but I can. This is still numb. I can feel that though. My beard is coming in bare. That's nice. But that's about it. I just thought I'd show you what was going on. And then, yeah, I'm coming up on a year. Kind of blows me away. I didn't even know like what to expect. You know, this whole experience so far has really taught me a lot about like myself. You know, obviously it's my favorite word. You know, but it's what I mean by that is it's obvious that going through this, you learn so much about yourself and like your strengths and everything. You reevaluate your fears and your wants and even people that you choose to keep in your life, and stuff like that. And you know, I've grown so much as a person, and I really don't think that, well, one, I don't want to get too dark or anything, but I don't know how long I would have lasted had I not realized who I really was. I was really sick, and it's really hard to get that across to people because, like, I didn't, like if you just saw me, just think I was like a skinny chick, right? But inside, like, I was so sick and wasn't eating and all of these things. So when I realized that, you know, that wasn't me and all these things, like, life just made so much more sense. And, you know, only being 11 months, almost 12 months, I really haven't even seen really the beginning. I mean, this is just the start. But I still have so much growing to do, and I'm really excited because, you know, I can't wait to, like, just keep growing and keep changing and learning, and it's crazy. Just blows me away, I guess. And I always get super sappy at the end of my videos, but it's the truth, you know, like, you go so long not knowing why you feel broken, not knowing like why nothing makes sense or you can't fit in or why you feel disconnected, and and then when you finally find like the reason why and you pursue it, even though you're terrified, and then you just realize that like everything I've ever gone through, and even through the transition, you know, everyone I've lost, all the pain I felt, you know, through surgeries and shots, and having my body like do a 180 as far as like hormones and muscle, and going through a second puberty and everything, it was all worth it, and I would do it again and again and again if it meant getting to this point in my life. And I just feel like there's clarity, you know, finally. It just took 25 years, but it's all worth it. Yeah, so speech over. Thank you for watching. I will be back as soon as I can. I'll probably do an update on the 5th of January, which will be my 1 year. I probably won't do anything like extravagant as far as like showing you pictures of me when I'm little, and my changes, because I'm not tech savvy at all. But thank you so much for watching and growing with me and asking questions and reaching out, and keep watching and talking. So I'll see you later, guys.